Welcome, and thank you for joining me. My name is Evan Hedrick. I'll be speaking to you tonight about the Central Healthcare Billing Agency, excellence in providing financial solutions to an increasingly complex healthcare system through positive, intensive patient auditing and advocacy. Designed as a 501c3 nonprofit, the CHBA offers more effective patient-focused care that is tailored to each patient in order to realize the best possible positive patient outcomes. This Central Healthcare Billing Agency takes outpatient care very seriously and has established a robust care network focused solely on caring for outpatients' bill consolidation and bill reduction needs. We dedicate our resources to delivering compassionate, high-quality, affordable healthcare services, serving and advocating for our brothers and sisters who are poor and disenfranchised, and partnering with others in the community through outreach programs to improve the quality of life through patient advocacy. We define our market as top-tier patient partner care providers. The total market size was approximately $241 million last year in 2014 and is expected to grow 18.3% by 2020. We currently hold 0% of this market and believe we can capture 5%, or about $12.1 million by 2018. For the primary task of establishing how the CHBA will operate in accordance with generally accepted accounting principles, it's imperative to point out that a qualified opinion means that the financial statements of this organization fairly represent in all material aspects the financial position, results of operations, and cash flows of the organization in conformance with the GAAP. Even better, the CHBA strives to contribute as a charitable organization with an unconditional exemption. A charitable organization is defined as an organization that provides community benefit or serves the public interest. In the case of healthcare, a hospital is a charitable organization if it provides care to people who cannot pay for their care or provides community health benefits. Even though the CHBA is not a hospital, it will still provide community health benefits regardless of a community member's ability to pay, easing tension and bringing the patient into the caring arms of the CHBA. In addition to providing top-notch community service, managing and maintaining the revenue cycle is essential to the business's continued survival, even as a 501c3. Revenue cycle, as you all know, is a multidisciplinary approach to reducing the amount of accounts receivable by effectively managing the production and payments. The pivotal first step in managing revenue cycle is to have policies and procedures for the registration and admission of all patients, or in our case, the registration and admittance of all members. As one of the steps necessary to the revenue cycle management, improving the RCM process is simple, even though it can often look complicated from the long view. The following steps will be taken to align this process. Provide upfront patient insurance authorization checklists. Receive denial requests in one location. Build a template database for the most common types of insurance. Provide a systematic way for billers to submit attachments. Submit necessary documents to the payer. And conduct admissions process review using the best practice research. To launch our efforts, we are seeking investor support in conjunction with personal savings funds and grants. Our target is to have $30 million in initial funding. We propose to grant investors repayment based on a set interest rate which is based on their investment totals. We plan to repay investors semi-annually for 10 years via the following model. For investments up to $100,000, a set interest rate of 3% assessed over 10 years will garner repayment based per 1,000 invested of $1,158.73. Up to $250,000, you will receive an interest rate of 3.5% assessed over 10 years for a repayment per 1,000 invested of $1,186.63. It can be expected up to $500,000, an interest rate of 4%, assessed over 10 years, for an investment repayment per 1,000 of $1,214.94. For up to $1 million in investment funds, an interest rate of 4.5% assessed over 10 years will garner $1,243.66 per thousand invested. And our final tier, for up to $100 million invested, an interest rate of 5% will be assessed over 10 years, garnering per 1,000 invested $1,272.79. The annual budget is expected to cost $6.35 million and is broken down according to the following model, as seen here. With labor costs expected to run $5.825 million, site facility costs, including water, internet, phone, and electric, to cost $44,500 per annum, and advertising costs to run approximately $480,000. That brings our total to $6.35 million. Now, the expected annual income based on membership totals of 125,500 members on average over the next 10 years will bring in approximately $9.935 million, with a realized annual income after subtracting operating costs of $3.5855 million. The CHPA, based on these numbers, expects to break even, assuming its $30 million funding target is met within 10 years, which includes complete repayment to investors at the given contribution levels. After the 10-year mark, the CHPA will become self-sufficient and capable of investing significantly more into the community through public outreach initiatives. Revenue projections shown in the budget are of average sustained memberships throughout the 10 years of operation, as stated earlier, with membership targets expected to increase to nearly 1 million by the 10-year milestone. The CHPA can realize projected revenues in excess of $90.6 million per year. This indicates that by 2025, the CHPA will have captured 31.7% of the market, which will be valued at approximately $285.1 million at that time. Now keep in mind, the CHPA acts as a patient advocacy organization. We work as a middleman for customers and/or patients between insurance companies, the government, and healthcare organizations like hospitals. The CHPA, therefore, is impactful, significant, and robust in its approach to the approach it takes to bring its purpose to life. There is a strong, centralized plan in place to guide operations into the distant future. We are ready to help our brothers and sisters. How about you? Join us today.